Well, I am delighted to be here today with Dr. Jae Brooks. Jae is a member of First Presbyterian and has been an invaluable member of our coronavirus task force for the last 6 months or so. Jae is a local physician with a specialist in infectious diseases, so he has had an area of expertise that has really helped us as a task force, and then making recommendations to our session to decide how we as a community would navigate living and doing ministry in the midst of a pandemic. So thank you so much, Jae, for taking time to be with me today.
Thank you for giving me this opportunity. I appreciate it.
Well, I want to start with asking you just a general question. I know certainly many of us are listening to the news and hearing lots of statistics that are concerning, but as somebody who is practicing medicine locally here in Richmond, what are you seeing and what are you aware of in terms of the activity of the coronavirus here in our community?
Well, as each of us has followed this pandemic over the past 8 months, you've seen wide fluctuations in the number of cases in specific areas and across the country and across the world. We were fairly optimistic in September that the trend was improving in the metrics in the Richmond area. The number of cases was better, the hospitalizations were down, deaths were down, and essentially every metric that we could follow was improved. That's taken a major U-turn in October and early November. Things have gotten worse throughout the central Virginia area and specifically in the Richmond metropolitan area. We've seen at least a doubling of cases, and in some areas of Richmond, Henrico, Chesterfield, Hanover, we've seen a tripling of cases over the past 5 weeks. That's been very alarming. As one would expect, hospitalizations begin to go up usually a week or two after the case reports go up, and then following that, the death rate usually begins to go up as well. That trend has now been steady over the past 4 to 5 weeks, and that has caused great concern here and throughout the rest of the country. There have been certain areas that have been devastated in the United States. We are not at that level right now. Hopefully we will not get to that level, but that is the concern, that with the winter season approaching, more people being indoors, children returning to school, holiday parties and so forth, we are concerned will even more rapidly increase the spread of COVID.
Yeah, and that is very concerning. You mentioned the holidays, and that was one of the things that we wanted the opportunity to talk about today in hopes of giving our folks just another voice in trying to navigate this. And I think the holidays are on everyone's minds, and what they're going to look like this year, what they should look like this year. So I'm hoping maybe you can offer some wisdom around that. And maybe we can start with thinking about those of us who know we're not going to travel for the holidays. We're going to be here in Richmond, but maybe we're thinking, could we host Thanksgiving and have people in our homes, or we've been invited somewhere to go to someone's. What would you say about those kinds of scenarios?
Well, I think the information from the CDC has been very convincing that we know how the virus is spread, and it's spread very easily by droplet spread. And so if we begin to congregate people in a home with masks off, enjoying the Thanksgiving celebration, eating, having a drink and so forth, that's a perfect method of spreading the virus from person to person. Traditionally, many of us have enjoyed large Thanksgiving get-togethers. We often have 20 people in the home with extended family and friends, and I think that is something that would be taking quite a risk in today's environment. Our plans are to limit the Thanksgiving celebration really to the primary family unit instead of having extended family, even from the Richmond area and friends. I know other people have planned an outdoor Thanksgiving celebration in their home and having more people there. That is better than having it indoors, but still, if you're going to have people together at a table and eating and drinking together, there still is going to be the risk of spread. And obviously that's weather dependent also. So it makes it more difficult. I would prefer an outdoor Thanksgiving celebration to an indoor, but I still think if you're planning on 20 or 30 people in a small area outdoors, the risk is still going to be there. We've seen that with outdoor parties, with people getting together on the beach, with protests, with everything around that you've gotten people together outdoors. That is not a completely safe way to do it, especially without masks on.
Yeah, that's helpful to hear. I know it seems like outdoors, a lot of us have been thinking if we can just be outside, then it'll be okay. But there are still some risks involved in that. We've been fortunate. The day we're recording this, it's 80 degrees outside on November 10th. So maybe we'll get some nice weather and be able to continue to safely gather outdoors. But that is very helpful to hear. I know my family's Thanksgiving is going to look a lot different this year than it normally would.
Yes.
What about travel over the holidays? What are you hearing about traveling?
The CDC has published guidelines on travel. First, you have to be able to travel from one city to another. If you're driving, that's fairly safe. If you're using public transportation, it would create risks. In addition, it would be wise to investigate the activity of COVID in your destination. There are certain areas that certainly are hot spots in the country right now. And traveling to those areas would be a much greater risk than traveling to areas with a very low rate of COVID activity right now. I think that should be taken into account. In addition, for both get-togethers in Richmond, but also for travel, we should also consider the vulnerability of the people who will be attending, whether you're traveling with grandparents, older people, people with medical problems. They are at much greater risk for severe cases of COVID. We want to see the older people in the family, but this may not be the time to do it.
Mm-hmm. Yeah, thank you. And you mentioned some of these CDC guidelines, and we're going to make those available to people as well. And I know that right now the focus is probably on Thanksgiving, but of course Christmas is coming up right behind that. And in talking earlier, you said the CDC has not put out specific recommendations related to Christmas at this point, but you expect that they will?
I'm certain they will. They have general recommendations just pertaining to holidays, but some of the special things about Christmas season, they have not put out real guidelines for that yet, like taking children to see Santa Claus. I know that will be a different experience this year. Santa Claus trains, church services, singing Christmas carols and so forth, going on Christmas caroling around your neighborhood or at churches. I think all of that will change this year because I can't imagine that the rate of COVID is going to sharply decrease in the next month. We never know what to expect, but it would be a true blessing if we saw an unexpected decline in cases over the next month.
Well, and another thing that we associate, particularly I think with the Christmas season, is holiday parties. But I'm assuming that what you said about Thanksgiving gatherings and large numbers of people, either indoors or outdoors, is something to be very cautious about.
I believe that Christmas parties will be very limited this year. We each have to make our own decisions, obviously, but it's very difficult to imagine large office parties, large parties at your home, even small parties with 15 or 20 people has the exact same risk and same concern. And I think that we're going to be doing most of this by video and getting together with people and seeing friends and family that way instead of our traditional way of getting together.
Yeah, well, and I know we can all be really thankful that that's a way to connect, as much as we're all really weary of seeing each other on screens and not in person. Well, Jae, thank you. This is so helpful to hear from you. And I know as a church community, everybody's got lots of sources of information, but it's great to hear from someone in our own church family who's working on this locally. We're so grateful for the work that you're doing. I'm sure it has been particularly challenging for you and your colleagues. Um, but in order to leave on a positive note, I'd love to hear if there's anything right now that's giving you hope.
Well, we all heard the reports yesterday on Monday the 9th about the new vaccine that probably will be released fairly soon. The vaccine has very good short-term results at about a 90% efficacy. There have been no serious side effects noted so far, although the follow-up is fairly short. But an effective vaccine would be a wonderful development. It would be a true pathway leading us out of the mess that we're in right now. Hopefully that will come to fruition. It may take many months to distribute a vaccine to the vast majority of people, but still it gives us hope looking forward to the spring and summer that perhaps we will be able to get it under control with a vaccine. That vaccine is not yet available. This year's flu vaccine is, and I would recommend everybody consider getting this year's flu vaccine as well. It would be very difficult if you get influenza plus COVID at the same time. So whatever you can do to keep yourself healthy would be a wise choice.
Yes, well, thank you. And that is hopeful and something we can all be praying about. And thank you again, Jae. So appreciate you taking the time to do this and all the work and advice that you've given us here at the church. And stay safe and enjoy your holiday celebrations. And thanks again.
Thank you. I look forward to the time we can do this in person instead of on the computer.
Me too.